Are you turning 65 and you're not sure how to navigate Medicare? In today's video, we're going to explain to you the 6 common Medicare mistakes individuals make and how to avoid those mistakes. Hello there, my name is Patricia St. Louis. I am a registered nurse. However, I help my clients navigate through Medicare every single day, okay? So in today's video, like I said, we're going to share with you the 6 common Medicare mistakes and how to avoid those mistakes. So let's get right into it. So the first common mistake is not understanding when to enroll in Medicare. You have to enroll in Medicare on time to prevent any penalty. So you have a 7-month window to enroll in Medicare. You have the month of your 65th birthday, you have 3 months before you turn 65, and you have 3 months after you turn 65. I highly recommend my clients to start the process 3 months before you turn 65 to prevent any delays, okay? If you enroll in Medicare after your enrollment period, so after the 7-month period, you will be penalized for not enrolling in Medicare on time. And you definitely don't want to make this costly mistake. So it's very important to enroll on Medicare on time, okay? So how can you enroll in Medicare? You could get on Medicare automatically if you're already drawing Social Security. So say you got Social Security at the age of 62, then you're already in the system, so you would get Medicare at the age of 65 automatically. Now, if you don't fall into that category, then of course you have to apply for Medicare. You could call your local Social Security office or call the 1-800 Social Security number and set up an appointment to go down to the Social Security office. You could apply over the phone or apply in person. You could also set up a SSA.gov account, and from there you could apply for Medicare, okay? So how are you eligible for Medicare? Well, if you work in the US for 10 years, 40 quarters, you paid into Medicare taxes, then you are eligible to go ahead and apply for Medicare. Can you delay Medicare? You can. If you have employer's coverage, you can delay Medicare, okay? And this has to be credible health insurance coverage, 20 or more employees working at your workplace, okay? And you have credible health insurance, like I said. That's the only reason why you should delay Medicare, okay? Now, if you have VA coverage, I recommend that you still get on Medicare Part A and B as well. Even if you swear you're only going to use VA benefits and VA doctors and hospitals and all of that, I still recommend that you go ahead and enroll in Medicare Part A and Medicare Part B. Why do I say that? And that is because a lot of clients do regret it later on. And if you didn't enroll on time, you would be penalized for every year you did not enroll. So it's very important to go ahead and get on A and B. Now that I said you should get on Medicare A and B, what is Medicare A and B? So Medicare Part A is your hospital coverage, and Medicare Part B is your medical coverage. Now let's move on to the second common mistake. The second common mistake is individuals assuming that Medicare pays for everything, like it covers everything, and Medicare does not cover everything, okay? It doesn't cover dental, it doesn't cover vision, it doesn't cover hearing, and other things that it does not cover. So it's very important to understand what Medicare does cover, so that way you don't just be going out getting services done thinking that Medicare is going to cover it and you get an unexpected bill, okay? So it's very important to understand what does Medicare actually cover, because it does not cover everything. In fact, Medicare only covers 80%, leaving you behind 20% of the bill. So individuals would either get on a Medicare supplement plan, which covers the 20%, or get on a Medicare Advantage plan, which have share of costs and you will have copays. So if you have original Medicare, you do want a supplement along with it to help with that 20%. And like I said, you could go with either a Medicare supplement or a Medicare Advantage plan and you can't have both, okay? The third common mistake is choosing the wrong Medicare plan, and this will most likely go for a Medicare Advantage plan. There's so many different Medicare Advantage plan options out there, so it's very important to choose the right one for your particular health care need. Is your doctor in network? Is your hospital preference in network? Are your medications covered? What about special treatments such as, do you go to dialysis? Do you have home health services? All those things are very important and things that you want to consider when you're choosing a Medicare Advantage plan. What about extra benefits such as dental, vision, and hearing? Is this important to you? So you want to look at all of that and choose the plan that best fits your needs. The worst thing is to choose the plan and go to the doctor, and your doctor is like, we don't take this insurance. So it's very important to choose a plan that best fits your needs. And the best way to do this is to work with a broker that you trust, that understands the plans in your area, that will help you narrow down the options and help you find the plan that best fits your particular healthcare needs. The fourth common mistake is ignoring the fact that you need to get on a Medicare Part D plan. You need a plan that covers prescription drug coverage. You could do this in two ways, okay? You could get on a standalone drug plan if you decide to enroll in a supplement plan, or you could get on a Medicare Advantage plan that also includes prescription drug coverage. And this is, like I said, Medicare Part D. D is easy to remember because D stands for prescriptions, your drugs, all right, that is prescribed by your doctor. A lot of individuals make this mistake because they're not taking any medications. Why should I be on Part D if I'm not taking any medications? Well, the reason why is because you will be penalized if you do not enroll in Medicare Part D on time. So it's very important that you get on a Part D plan. You cannot go more than 60 days after your Part B start date, okay? So yeah, get on a drug plan even if you're not taking any medications. The fifth mistake that individuals make is simply not understanding the difference between a Medicare supplement plan and a Medicare Advantage plans. These are two different type of Medicare supplement policies. I would call them supplements, but one is called Medicare supplement and one is called Medicare Advantage. Like I said before, original Medicare only covers 80%, leave you behind 20%. So it's very important to know the difference between the two. So let's go over the difference really quick. With a Medicare supplement plan, it follows original Medicare. It literally pays the 20% that Medicare leaves behind. You will have an additional premium. You have your Part B premium and you have your supplement premium as well. Like I said, the supplement will pay the 20% that Medicare leaves behind. So whatever original Medicare covers, the supplement covers it as well. The pro about a Medicare supplement is you could go to any doctor that accepts original Medicare. You could travel with this plan as well within the US. A Medicare supplement plan is a great option for individuals that have a chronic condition or have any type of family history that could potentially be passed on to you, such as cancer or any type of chronic condition. Why is that? Because when you first turn 65 and you enroll in a Medicare supplement plan, there's no underwriting, meaning there's no health question. So you can get on a Medicare supplement plan. It doesn't matter your health condition at the time of you turning 65. However, after 6 months of turning 65, you do have to go through underwriting to get on a Medicare supplement plan. So if you're ill or if you have a chronic condition, depending on what the condition is, you may not be able to get enrolled into a Medicare supplement. Some of these conditions could be some chronic conditions dealing with the heart, diabetes with complications, Parkinson's, dementia. So those are some of the chronic conditions that would be a automatic no when you go through underwriting when it comes to getting approved for a Medicare supplement plan. Now let's talk about a Medicare Advantage. With a Medicare Advantage, it works a little different. Instead of the Medicare Advantage plan paying all of the 20%, it does a cost of share with you. You kind of pay as you go. You pay co-pays as you use the plan. There's two main type of Medicare Advantage plans. You have your HMO plans and you have your PPO plans. You cannot go to any doctor that takes original Medicare, right? Because the Medicare Advantage plan replaces original Medicare, so your doctor have to be in your plan's network. So it's very important to make sure that when you're choosing a Medicare Advantage plan, you're looking at your doctors, you're looking at your medications, and some of the things that I have stated before. When it comes to a Medicare Advantage plan, you cannot just go to any doctor, like I said. You cannot just travel with a Medicare Advantage plan. It depends on the plan itself. So it's very important to know the difference between a Medicare Advantage and a Medicare Supplement. Most Medicare Advantage plans are $0 per month with copays, okay? So that's the difference when it comes to Medicare Advantage and Medicare Supplements. And it's also very important to take note, and I've kind of said this already, you cannot have both a Medicare Supplement plan and a Medicare Advantage. You cannot have both. That is against the law, okay? Now let's talk about the 6 common mistakes that you definitely want to avoid. And this is simply not enrolling in a Medicare savings program if you are eligible. A lot of individuals make this mistake. So what is the Medicare savings program? The Medicare savings program will actually help you pay for Medicare Part B if you qualify. So this program is designed for low-income seniors. Like I said, if you qualify, then you don't have to worry about paying for Medicare Part B, which is very helpful for low-income seniors, okay? There are several different levels of Medicaid. If you get approved for the highest level of Medicaid, your Part B premium will be paid for, co-insurance, deductibles, and co-payments as well. So whatever Medicare doesn't cover, then the highest level of Medicaid will cover that cost as long as the doctor accepts both Medicare and Medicaid. By the way, if the doctor does accept Medicare, he also has to accept your Medicaid as payment as well, if you have the highest level of Medicaid. Now, there's another level of Medicaid, and this is called SLMB. This is the second level of Medicaid. It will pay your Part B premium, but it will not pick up additional co-pays, deductibles, and such, okay? And then the next level of Medicaid after that is called QI, which is qualifying individual. And with that level, which is the lowest level of Medicaid, it is based on a first come, first serve situation. Now, when it comes to Medicaid, applying for Medicaid overall is going to be based on low income and limited resources and assets, okay? Meaning you can have one house and one car, and you have to be low income as well. And it is based on your particular state, okay? So the Medicare savings program is also Medicaid. So those two programs work hand in hand together. So if you're going to apply for Medicaid within your state, these are the boxes you definitely want to check. So you want to check Medicaid, you want to check the Medicare savings program, and you also want to check for individuals that is disabled or age. And age would be for individuals 65 and older, okay? All right, so I hope I made it really clear on the 6 common mistakes and how to avoid those mistakes. If you have any questions, leave them in the comment section below. And if you need help with any of these services, when it comes to Medicare, give our office a call. We'll be more than happy to assist you. And if you have a friend that needs this information, definitely share this video with a friend. Subscribe if you're not already subscribed. And I'll see you on the next video. Thank you so much for watching. Bye.